Have you had a difficult time establishing care with a primary care provider? Or do you have a primary care provider that you can never get in with when you're sick? Have you had a difficult time finding a primary care provider that is taking on new patients, or taking Medicare patients or Medicaid patients? Do you live in a rural area making access to healthcare difficult to meet your healthcare needs or those of your loved ones? Are healthcare costs or insurance costs sucking your bank account dry? Are you on the fence about seeing a nurse practitioner or physician assistants? Or are you just unsure about the nurse practitioner role? The always changing healthcare paradigm affects everyone at some point in time, one way or the other, whether you are working in healthcare or seeking healthcare. The goal is for it to have a positive effect, not negative. I've experienced the healthcare crisis on the provider and the patient and family end, from working in an overcrowded ER for 13 years to watching my dad shop around for a doctor that would take him on as he was now a Medicare patient with multiple comorbidities. Being able to provide quality health care based on evidence that's cost effective, and secondly, to make sure that we can provide access to care to all persons who need it, continues to be the most difficult challenge healthcare providers face, and will become increasingly challenging with the primary care provider shortage projected for 2023 and 2025. Primary care is often viewed as an essential determinant of health systems' equity, efficiency, and effectiveness. There is a perceived health professional shortage quickly approaching in the next 3 to 5 years, making it a great need to identify different avenues to meet the healthcare needs of the people. The most popular solution to alleviate the primary care crisis is by utilizing nurse practitioners, NPs, as primary care nurse practitioners, as they provide a safe, cost-effective means of supplying health care. I know what you're thinking. Cost-effective? This is my life we're talking about. I understand. That is why, in this short video, I'll be discussing the role of the nurse practitioner within the system here in the United States as well as globally, and utilizing the nurse practitioners as leaders in filling the gap in primary care. Hello, I'm Allison Ellis, and I'm an advanced practice registered nursing student in the Family Nurse Practitioner program at Auburn University. And in this video, I would like to share with you how the Advanced Practice Registered Nurse, or APRNs, are playing a major role in the way quality health care is being delivered. Nurse practitioners, through their history, were well positioned to be leaders in the healthcare system. Over 50 years ago, Dr. Loretta Ford was a public health nurse that recognized the healthcare needs in the rural communities. Dr. Ford viewed nurses as well positioned to fill this need and to provide the care to these communities. So she thought, let's take nurses and give them more education and training and to allow them to practice independently. With this innovative solution to meet the healthcare needs in the rural communities, Dr. Loretta Ford and Dr. Henry Silver developed the first nurse practitioner program back in 1965. She integrated the traditional nurse role with advanced medical training, and from this brought this new healthcare professional. Thus emerged the nurse practitioner with a focus on illness, health prevention, and health promotion. As you can see from the brief nurse practitioner history, it is evident how important the nurse practitioners are as a part of the healthcare team. With the background of the APRN in place, let's take a closer look at the role of the nurse practitioner. Then I'll address the role of the nurse practitioner in healthcare today. And last, I'm going to discuss the barriers in healthcare with a focus on the perceived physician shortage, and discuss how the utilization of the nurse practitioner as primary care practitioners can affect the projected health crisis quickly approaching in the next 3 to 5 years. The advanced practice nurse role is really a critical role to patient care. It takes a team of individuals to care for patients effectively, and the advanced practice nurse has been trained his or her entire life in patient care with a patient focus. Take my medical career, for example. I have been in the ER for 13 years as a nurse and now pursuing my degree in primary care, or FNP, my family nurse practitioner. And there's the National Council and the State Board of Nurses has created a long list of regulatory requirements that each advanced practice registered nurse must comply with under a model known as the APRN consensus model. Under the consensus model lie many requirements, including completing an accredited graduate level program, passing national certification exams, and acquiring advanced clinical knowledge and skills, preparing them to provide a direct care to patients. Finally, the advanced practice registered nurse is practiced in one of four roles, which is including the certified registered nurse anesthetist, which is a CRNA, or the certified nurse midwife, or CMS, or a clinical nurse specialist, also known as a CNS. And then there's a nurse practitioner, or the NP. NPs are advanced practice registered nurses that have completed a graduate level education in either a master's or a doctorate degree, a DNP. Nurse practitioners hold a national board certification in their area of specialty, including family, pediatrics, geriatrics, adult, and acute care. The nurse practitioner's core philosophy is individualized to the condition, but also its effects on the patient and their family. The nurse practitioner emphasizes prevention, wellness, and patient education. In addition, the healthcare duties of the nurse practitioner also conduct research and also strive to be patient advocates. The practice setting for the nurse practitioner can include family practice, pediatrics, women's health, and internal medicine clinics. And they're generally work settings of the family nurse practitioner. Often, family nurse practitioners are found in outpatient ambulatory settings like independent or partnered practice clinics or community health clinics. The APRN also are respected providers in managing care organizations, businesses, or governmental agencies. And because of their advanced skills, nurse practitioners have more authority over administering patient care compared to the registered nurse. For example, the nurse practitioner can prescribe medication, administer physical exam, diagnose illnesses, and provide advanced medical treatment similar to a doctor. While NPs have more authority than RNs, the practice physician level type care, some states require doctors to supervise their patient care decisions. This decision varies from state to state. Now, this is a part of the nurse practitioner scope of practice that can be confusing for some, as the AANP, which is American Association of Nurse Practitioners, describes nurse practitioners as licensed independent practitioners who practice in an ambulatory, acute, or long-term care as primary and or specialty care providers. The word independent gets confusing as it differs from state to state, and there are collaborative agreements that are written contracts designating a licensed physician as a nurse practitioner's collaborating physician. This outlines a working relationship, usually involving the prescriptive authority and scope of practice of the nurse practitioner, as well as documentation, review, and consultation availability. A nurse practitioner's authority to prescribe medication is referred to as a prescriptive authority. A nurse practitioner's prescribing ability in some states require a relationship with a physician that outlines the specifications, while some states' laws allow nurse practitioners to prescribe medications independently without physician oversight. Other state laws require the nurse practitioner to complete a transition to practice period before being able to prescribe independently. As you can see, this can get difficult to understand as it is different from state to state. But many states are taking action through forming coalition groups. For example, multiple professional organizations are behind the solution to focus on the nurse practitioner's profession so they can practice to the full extent of their education and training. Thus, consumers win high-quality, cost-effective health care. The advanced practice registered nurse is already making an impact on the delivery of quality care globally, but today's focus on the profession to empower the advanced practice registered nurse to fill the gaps of care in multi-settings and to provide care in rural areas where it has not been provided in the past. It is time for us to rethink the advanced practice registered nurse. Now, the future of nursing and healthcare, I would like to leave you with these 4 key points. Nurses are and have been leaders in healthcare. Second, nurses should practice in the fullest extent of their education and training. Third, nurse practitioners should be full partners in healthcare with physicians and other professionals. We need to redesign healthcare in the United States, and we need effective workforce planning and policymaking to collect data better and to improve our information infrastructure. So as nurse practitioners, we are positioned to make and lead these changes. Thank you very much. I hope this has been informative, and I hope you have a better understanding of the nurse practitioner role and our future responsibility and role in healthcare.